This is part 2 of the chapter 19 video. The first recorded lecture went over phenytoin, and the second part of the lecture is going to go over the different other classifications of anti-seizure drugs that are presented in the textbook. So the first classification we're going to talk about is barbiturates. This isn't new to you. We just talked about it. Phenobarbital, again, is your prototype barbiturate, and this time it's in the sense of being used for as an anti-seizure drug. So for these next medications we're going to talk about, you need to know the classification, the prototype drug, how does it work, what the therapeutic serum range is, and then any additional information I might provide about it. So for this first one, phenobarbital is your prototype. Classification is barbiturates. It works by enhancing GABA activity, and remember GABA is that inhibitory neurotransmitter. Therapeutic serum value for phenobarbital is 20 to 40 micrograms per milliliter. Side effects include sedation, intolerance, and a teaching point for patients is discontinuing the medication should be gradual to avoid reoccurrence of seizures. There we go. The next classification you need to know is succinimide. Your prototype drug is ethosuximide. The medication works to prevent seizures by decreasing calcium influx. The therapeutic serum range for ethosuximide is 40 to 100 micrograms per milliliter. Some adverse effects include blood dyscrasias, renal and liver impairment. Next classification, if I can get it there, is benzodiazepines. Not new to you. PAMs and LAMs, right? You have two PAMs listed here, clonazepam and diazepam. Again, this isn't a new classification for you, so we're not going to spend a whole lot of time on it. Trying to look here. I just want you to recognize again those endings, PAM and LAM, as being medications that belong to the classification of benzodiazepines, and that benzodiazepines are used to treat seizure activity. Next classification is aminostobine. Your prototype drug is carbamazepine. I'm not worried about you knowing the specific seizures that they're used to treat, right? You do need to know the therapeutic serum range, which is 4 to 12 micrograms per milliliter. Your next slide lists some side effects and adverse reactions for carbamazepine. Worth noting, it can have an interaction with grapefruit, so you'd want to teach your patients not to take carbamazepine with grapefruit. Next classification is valproate. Your prototype drug from the classification of valproate is valproic acid. Therapeutic serum range for valproic acid is 50 to 100. You have some side effects there I'm going to let you look at on your own there. Anti-seizure drug dosage usually starts slow and gradually increase over a period of weeks until the serum drug level is within therapeutic serum range or the seizures cease. Serum anti-seizure drug levels should be monitored closely to prevent toxicity. So just again, another review of therapeutic serum range. If my patient's taking valproic acid and their serum level is 200, am I worried about the medication not working well enough, or am I worried about toxicity? Since the therapeutic serum range is 50 to 100, if their serum level is 200, it'd be too high. I'd be worried about toxicity. If their serum level is 20, it would be too low concentration of medication, not enough medication in the system. And in this instance, valproic acid being used for seizure, I would be worried about the patient experiencing seizures because of that. So we usually don't talk much about pregnancy and medications. We sort of hit on it lightly. But for anti-seizure drugs, I do want you to be familiar with this slide. Seizure episodes increase 25% in women with epilepsy who are pregnant, and most anti-seizure drugs are teratogenic. Anti-seizure drugs tend to inhibit vitamin K. If you remember, vitamin K plays a role in clotting blood. So if the pregnant woman's taking an anti-seizure drug that's inhibiting vitamin K, we're worried about hemorrhage. So taking that anti-seizure drug can contribute to infant hemorrhage soon after birth. Vitamin K may be given during the last few days of pregnancy or given to the infant soon after birth. Anti-seizure drugs increase the loss of folate or folic acid in pregnant patients also, so they would need daily supplements. Febrile seizures are seizures that are associated with fevers, usually higher fevers. They usually occur in children between the ages of 3 months to 5 years of age. Basically, in terms of that, I just want you to remember the nurse's role in teaching caregivers about treating infant and child fever. So again, they can use acetaminophen as an antipyretic and NSAIDs like ibuprofen as an antipyretic to help keep the fever from getting to a point where it's so high that it actually causes a seizure in the child. Status epilepticus is an emergency situation in which basically the patient just has repeat seizure after seizure with no amount of rest. So the body can't recover at all. So I want you to know that status epilepticus is a medical emergency and treatment needs to begin. If you look on page 253 at the very bottom of table 19.3, it lists status epilepticus and then the drugs listed that will treat the disorder. And I want you to recognize that the benzodiazepam or lorazepam would be the medication given first to treat status epilepticus. And then the other medications listed there, I want you to remember as other drugs that can be used to treat status epilepticus. All right, we're going to move on to the questions here. I'll read them. You can pause and try to answer them. Question 1, what is the highest priority nursing diagnosis for a patient taking phenytoin? If you picked answer B, you are correct. The nursing diagnosis risk for falls has the highest priority for a patient taking phenytoin because it may lead to side effects of dizziness, decreased coordination, and ataxia, anxiety, constipation, and inefficient fluid volume are not side effects, or deficient, it should read there. Deficient fluid volume are not side effects of phenytoin, but depression and discoloration of urine are. Question 2, before administering a daily dose of phenytoin, it is most important for the nurse to, B is the correct answer, check the phenytoin level is the most important because of the narrow therapeutic range of 10 to 20. Maintaining bed rest and monitoring INO and renal function tests are not necessary. Question 3, a patient was discharged 3 days ago on phenytoin therapy for seizure disorder. The patient comes to the ED experiencing seizures. What will be of most value to determine the etiology of the return seizures? Correct answer is C, serum phenytoin levels. Again, the therapeutic serum range is 10 to 20 and it must be maintained. Subtherapeutic or low serum levels are a frequent cause of seizures for patients taking phenytoin. Question 4, when assessing a patient taking hydantoin therapy for seizure disorder, what indicates an adverse reaction to this therapy? Correct answer is A. Severe side effects of hydantoins include thrombocytopenia, leukopenia, gingival hyperplasia, and hyperglycemia. Practice question 5. A patient is experiencing status epilepticus. The nurse anticipates immediate administration of which drug? If you answered D, diazepam, that is correct. Diazepam is the drug of choice for status epilepticus, administered IV or lorazepam, followed by IV administration of phenytoin. For continued seizure, midazolam or propofol is used, followed by high-dose barbiturates. But again, for our purposes, I want you to recognize diazepam or lorazepam as being step 1 to treat status epilepticus, and then the other medications listed on table 19.3 as being other medications used to treat status epilepticus.